Hello friends, today we'll see how we can code orthography procedure codes and what are the CPT codes used for coding this procedure and what are the supporting CPT codes used along with the known procedure codes. First, we understand what is the definition for orthography. Orthography is a type of imaging test used to look at a joint such as shoulder, knee or hip. It may be done if standard x-rays don't show the needed details of the joint structure and function. So it is done when there is joint small minor procedure like x-rays are not enough to get the final diagnosis. So for this some advanced procedure like arthrography is done. In arthrography, actually a long thin needle is used to put contrast dye right into the joint. So this dye will be put and the images will be generated, and those images will be helping reviewing the joint to find out what are the problems happening in the joint. So that is lead actually orthography procedure. Then here we are using an imaging guidance, fluoroscopic guidance 77002. If no SNI procedure or no SNI supporting documentation is there, that we'll see in the next slide. So these are the actually orthography codes for each joint. For shoulder 233350, and there is a supporting code 73040 for SNI supervision and interpretation. This will see why we use SNI codes here. Elbow orthography we have 24220, again SNI code 73085. For wrist orthography 25246, SNI code is supervision and interpretation 73115. For SNI joint orthography for non-Medicare 7096. For Medicare we have two codes, with and without orthography and with orthography. So these two joints, others are also having, but these are not having an SNI code, so they may be including the SNI code. Let us see what are the things to remember in coding orthography. So steroid injection should not report orthography codes. Orthosynthesis code should be used. So in orthography no steroids are used, only contrast is used. If steroids are used, you can use the orthosynthesis codes directly. Orthography CPT codes can be used multiple times for separate injections on same joint. So if orthography procedure is done on and they are done multiple times on same joint, main procedure you can code, but SNI code should be used only once for same joint. You can code the injection multiple times, but the SNI code should be coded once only. So 70,000 series you can code only once, but the main procedure code will be coded multiple times depending on the number of injections done on that joint. When contrast orthography is performed, imaging guidance is bundled. So if contrast orthography is performed and SNI is also supporting documentation is there for SNI, so imaging guidance is bundled in those exams, because SNI, if SNI is coded, you don't need imaging guidance, only SNI is enough with orthography code. When contrast is injected only for CT or MRI orthography, then report only the fluoroscopic guidance code for needle placement. So if only contrast is injected and no findings are there, no information is given after injecting the contrast, if anything is seen or not in the joint, only just contrast is injected, you cannot code the SNI code. You have to code only the imaging guidance, because SNI codes need documentation supports to code. If no findings are there, you cannot code SNI code. So in that case you can code the imaging guidance. Preference will be SNI code, but if there is no supporting documentation for SNI, then you will code the fluoroscopic guidance code. When there are findings documentation after contrast injection, then code SNI code, and if no finding documentation, you can code imaging guidance code. So that is what we have discussed. Findings are there, code SNI code. No finding, directly code imaging guidance code. but do not code the SNI and imaging guidance code together, because it should not be happening together. So cannot be coded together as per coding guidelines. Either SNI or imaging guidance should be coded depending on the documentation. So this is the sample report where you have to code arthrogram shoulder left CPT code. So you can see here I have highlighted they are using fluoroscopic guidance here, and they have injected and contrast of isovac 10 cc of isovac 300. So here the patient is going through an shoulder arthrogram procedure, and you can see using fluoroscopic guidance, a needle was placed into the joint space and a mixture of 10 cc isovac 300 contrast was introduced, and gadolinium also was introduced. Time is also the fluoroscopic time. If suppose this much only is given and below finding is not there, then you will quote fluoroscopic guidance. But here you see findings are there. They are mentioning what they have seen after the contrast. Marginal osteophyte along with the inferior margin of glenohumeral joint. Degenerative spurring is there, no rotator cuff defect identified during arthrogram. So these findings are there given, so we can quote the SNI code, supervision and interpretation. So on the basis of that, we have coded the main procedure code arthrograms 23350 with LT modifier, and SNI code 73040 SNI code. So this is the way we have to code the arthrogram procedure code. This is the sample report for shoulder. So this is the final slide, and hope you have got the point what I want to discuss. Here also I have shared one more CPT for coding G0260. This is for sarcoiliac joint. In this, only difference is you can see they have injected Kenalog. Kenalog is actually an steroid. So this actually leads to an injection procedure in which steroid is used. So we have a separate code for that. So here J0260 is used because the patient is Medicare. So it says injection procedure for sacroiliac joint provision of anesthetic, steroid and or therapeutic agent without orthography. So here they have injected steroid, so we are using a code G0260 and the location is sacroiliac joint. So we are coding it as G0260. So here no need of SNI code because it's a steroid injection code. If arthrogram was done and there are some supporting SNI code, then we would have coded it. But here they have included all the things, so no need to code any extra code for this G0260. We have given LTRT because both have done on the same side. So this is actually the proper documentation and coding for the arthrogram procedure. So this you can understand the difference here. One is with contrast here and one is happening with an steroid injection. So both are having different codes, and you see the documentation as well how to code this procedure. So thank you for watching this video. If you gain any knowledge in this video, please like it and do subscribe to my channel. Thank you again.